Thanks for joining us today. We're having a lot of fun doing these Facebook Live seminars, and we hope you're enjoying it. And we also hope that you're getting some good and useful information. And remember, you can always call us or text us on the chat line if you've got any questions. So today, we are going to be talking about hip pain and dysfunction. This is a really important subject because the muscles around the hip and pelvis are so important that they stabilize for the upper body and the lower body. So everything you're doing with your legs, your back, your upper body depends on that good stability in the hip and pelvis. And there's a lot of things that can go wrong. So we thought this was a good topic for today. But before we do, just want to make a couple of comments. With this COVID-19 pandemic, there's a lot of things going on. There's a little bit of confusion as far as I'm concerned. You're supposed to wear masks. You weren't supposed to wear a mask if you're healthy, and then you were supposed to wear masks if you were healthy, and then you're wearing masks to not get sick from others, and then you're wearing masks to get sick from others, and then they said again, you don't have to wear a mask unless you're required to wear a mask. But just to let you know, here in the clinic, we're following CDC guidelines. We are wearing our masks when we work with our patients. We're cleaning everything and keeping this environment nice and clean, and it's going very well for our patients here in the clinic. But wearing masks is great, but if you're like me, I've been more inactive, and so I'm at home more often, and we now have right and left hand snacks, which is not so great. When I walk into the kitchen, I grab a snack out of the pantry with my left hand, and on the way out, I grab a snack with my right hand. Not so great. Becoming more sedentary, really not great. So as we do less, we're eating more, and we tend to set ourselves up some other problems. So there's a lot of health conditions where overeating, over drinking, gaining weight, becoming deconditioned is really, really not great. So we would just like to really encourage everyone, whether you go outside or stay inside, that's your choice, but just stay active. Try not to sit around so much. Get up, move around. If you're on the computer a lot, watching TV, get up every half hour, move around, do something, and stay active. Okay, the thing with the hip that's important is sometimes that hip pain can come from the back, sometimes it can come from the hip. And that's kind of what we specialize in, helping determine what the problem is, because it's not always clear. You can have pain right in the middle of the buttocks, and that can come from the lower lumbar spine, your low back, or it can come from the hip joint. And there are special tests, specific tests that we do to test that and determine what the problem is. Because if you're treating the wrong area, then the pain in the hip is not going to go away. Okay, some common problems that we see. You've all heard about hip bursitis. And just to clarify that, that's when the bone on the side of your hip is tender to the touch. Okay, there's also hip osteoarthritis or just arthritis in your hip. There's hip impingement, which we'll talk about. There's IT band syndrome, which we see a lot in runners. And then there's the proximal hamstring tendonitis, or where it attaches to the pelvis. So just looking at the anatomy a little bit. So here is the hip joint. It's a ball and socket joint hooked into the pelvis, and then the pelvis is hooked to the sacrum, which is hooked to the lumbar spine. So you can see the lumbar spine and the hip are fairly close together, and they're tied in together and dependent on each other. Now when we overlay it with a lot of the muscles, so there are muscle groups that cross from the hip down below the knee that just cross the hip. There's muscles that cross the hip and go up and attach to the spine, and everything in between. So if there's instability in the pelvis, weakness in the hip and pelvis muscles, it can affect below and above the hips, affecting the low back and the legs below. This is a picture of the hamstring muscle, which we'll talk about a little bit more on another slide, but it's made up of three parts. and they start on your sitting bone. So when you sit down on it, that's right where it attaches, and then they pass down and they cross the knee joint, go below the knee joint on both. So they're a two-joint muscle, and they really are very important in a lot of functions of the back, knee, pelvis. Okay, and then here's some more overlaying muscles, and these are on the outside and the posterior part. And these muscles, again, are very important in stabilizing the hip and the pelvis and everything above and below the waist. So hip bursitis. Sorry about that. So over this bone, where the redness is in that line showing, there's a bag of fluid, and it kind of sits in between that and the tendons that attach and pass over that area. The idea is to prevent those tendons from rubbing on the bone and wear and tear on the tendons and soft tissue. The problem is it's a fluid-filled bag, and if it gets inflamed, it starts to expand, and then as that tendon rubs back and forth over it, it irritates it more, and pretty soon you've got some significant pain there. So if you poked on the outside of your hip, right over that bone, and touching is very, very tender, chances are you have a hip bursitis, and it can refer pain in this light purple shaded area, sometimes a little bit lower, but mainly in that area with specific tenderness over that point. Lots of times we find when people have bursitis and other hip problems, they have weak hip abductors, or that muscle that attaches from your pelvis to the side of your hip. And when that's weak, it can allow lots of problems, too much instability in the area causing wear and tear, and bursitis is one of those. If you have hip bursitis, so you got the pain over this bone, and you stand around standing on one leg, this stretches the tendons, muscles over the bursa, so it's actually irritating it, and you can get pain in this area. So standing like that can actually exacerbate the problem and keep it going. Sometimes people have leg length discrepancies. So if one leg's longer than the other, then you usually stand on the shorter leg and the hip bows out, and you end up in this stance like the lady on the left side of the screen, and that can cause problems. So leg length differences is one of the causes of bursitis. If you have hip bursitis, laying on the side that hurts can actually irritate it and keep the problem going. So some people, because they don't want to sleep on their back and don't want to sleep on their stomach, which is great, I don't recommend that one, will sleep on the opposite side, and if they put a pillow between their knees, then it takes the stress off of that bursa area, and it's more comfortable and less likely to aggravate the problem while sleeping. So this is a video that's showing when someone has weakness in that gluteus medius, or that hip abductor muscle we're talking about. If they have it on one side, when they step on that leg, they tend to throw their body over that side, because then the muscle doesn't have to work, so it makes up for that weakness. If they have weakness on both sides, you'll see them almost like a penguin. They're throwing their body side to side like a waddle, and we call it a Trendelenburg gait or lurch. So on the way out, I'm demonstrating if I had just a weak muscle on one side, and on the way back, you'll see what it looks like if somebody has weak muscles on both sides. So if you know somebody, it's obvious when they walk like that. And if you know somebody that's got this problem, they need to get in and get some help. So at the end, we'll give you the contact information, but have them come in here. There are ways to improve that and improve that strength, which will then also decrease the problem that they're having with their hip. So here's the video. So that's showing a left-sided weakness. So I'm throwing my body over the left so the muscle doesn't have to work. If you have weakness on both sides, you just throw it side to side. So that is hip abductor weakness, and again, that's one of the problems that is common in almost all the hip pathologies. Okay. Alrighty, so we're now going to talk about hip arthritis or osteoarthritis. So here's an x-ray, and you can see the ball and the socket, and you can see the dark space in there. So that's good spacing, meaning there's good cartilage in there, And so those should be normal hips. Now this picture, you can see that space is now gone, and it's actually, you see this white bone, it's actually really hard, what we call sclerotic bone. So as the cartilage wears out and there's more bone on bone, the bone hardens. And that's that arthritic hip. It's stiff, it's painful in the morning, you feel the weather, you do too much, it hurts, you don't do anything, it hurts from getting stiff. So movement and low impact exercise can help keep up strength and lubricate what's left of the joint and decrease the pain. So things such as riding bicycles. Hi Ken, the mail guy just came in, our favorite friend. He's got great hips. So riding a bicycle, swimming are great low impact exercises. They also use the core muscles, especially the swimming, and can be a great benefit to you. So even though you have the arthritis, you don't want to be inactive. That activity can help maintain what you have and decrease some of the pain and keep the strength going and keep your life more active. Okay, hip impingement. This one can hit young and old. Probably the youngest person I had with this was a high school basketball player, and he went from starting on the team to having difficulty running, jumping, cutting, and squatting, and he had to quit playing basketball. He came in with the diagnosis of a low back problem, but it turned out after we did the testing that it was actually this impingement, and he ended up having surgery, which was very successful. We were able to rehabilitate him, and he got back to normal life again. But what you see is you'll have an over buildup, almost like an overbite, and you see here's the ball, here's the socket, so it almost comes over like an overbite in this pincer mechanism, and in the cam mechanism, the neck of the femur here gets an extra buildup, so you can see it could impinge between there with certain movements. Here's an x-ray, and you can see this is the pincer, so it's like a little fang or tooth, and that can just keep chewing and causing problems, and it can be quite painful. This is one that you can kind of check yourself. If you have pain in the front of your groin area, if you lay down on your back and then pull your knee up towards your chest, straight up or towards the outside, if it's your right knee, if you pull it straight up or towards the right side, the right shoulder, you shouldn't feel much pain. But if you turn the knee and rotate it inwards and then pull it up towards the left shoulder, you will have pain in the groin. Not tightness or stretching, but it's actually a pain. And this is one of the most common tests we do. And we pick this up, and if it's severe, people end up getting surgery to cut that tissue out, the bone out, and often this prevents future hip problems such as arthritis. Lots of times, though, if it's caught early, we're able to do therapy, teach you exercises, and you can get past the problem. But when you have this problem, sitting in low chairs is painful. Squatting down hurts in the front of the hip. Jumping is not good. And running is also painful. So one other lady I had that had this problem, she liked to run and she liked to water ski. But because this problem was significant, she came in, we did the testing, and we actually found this problem. She had given up jogging, she'd given up water skiing, because water skiing you have to start in that flexed hip position, and running, of course, was impactful. She ended up getting surgery on her in her condition. She came in, we were able to rehabilitate her, and she got back to doing her exercises, teaching exercises classes, water skiing. And so this is really one of those problems that can be fixed. If caught early, it can be conservative. If it's later on, it's a surgery that has good outcomes, but you definitely have to have some physical therapy to guide you in your rehab, or you could make things worse. And this is where you typically feel the pain. So now we're going to talk about IT band syndrome. So this is the area you usually feel it, but here's the anatomy of it. You have your gluteal muscles, and you got your TFL muscle here, and they're actually the tensioners of this IT band. And it goes from the hip, the pelvis, down over the side of the hip, and attaches down actually below the knee with some fibers going into the kneecap or patella. This is a common problem that runners get. So one of the problems is people that like to run on tracks, if they run the same direction every single day, there's a force that pushes that knee out, and underneath that band is a bony protuberance, and the band will start to rub over that and get inflamed. And the more you do this activity, the worse it gets to where you can't run anymore. So running the same direction around track is not good. If you change every other day, that's great. Also running on crowned roads. So this, you've seen a lot of the roads, so the center's higher and then it slopes down to the gutter. So in this case, she's running on a level road, so the pelvis, both legs are going to hit, the pelvis is going to be level. In his case, running on the side, you can see the road is sloped, so it's going to put pressure on the side of his knee. I actually developed this problem while running in a marathon. About 10 miles into the race, I've been running on the right side of the road, and the right side of my knee started to hurt. Well, I knew I wanted to finish the race, so I just switched and ran down the left side of the road and took the stress off my right leg. And then it took me a month or so to get past it, and I was able to get rid of the problem. This is another thing. If you have a leg length discrepancy, this can cause problems and lead to this IT band syndrome. So things such as going up and down stairs can be really painful. And again, it'll be the outside of your knee. Hiking downhill. So this has happened to my wife many times. Hiking uphill was not a problem, but going downhill would irritate it. But if she took wider steps or had to keep her feet wider apart, she was able to go down with less pain. If you have this condition and you ride bikes, so a lot of repetitive flexion, that tendon just keeps flipping over that bone, and once it's inflamed, it just makes it worse. Repetitive squats is also a problem. And this is one that you find hip or weak hip abductors just like the other conditions. And so when you run and there's that 250, 300% body weight on each step, if that muscle on the outside is weak, then it's going to put a bowing out here and cause you some problems, and you could develop the IT band syndrome. Okay, proximal hamstring tendonitis. So proximal means just closer to the origin. So this muscle attaches to the sitting bone. So that bone that when you're sitting on the hard chairs, you don't like it, that's where it attaches. And it breaks into 3 parts, 2 on the inside of your leg and 1 on the outside of your leg. This is where you'll feel the pain usually on a proximal hamstring strain or tendonitis. Things such as quick takeoffs, running sports where you're cutting and pushing off quickly can cause problems. Explosive sports like jumping, like this feller. I hope I can still do that when I'm his age. And sitting a lot. So if you've got this problem and you're sitting on a chair for long periods of time, it really is uncomfortable and actually causes the problem to become worse. There's also a bursa on that bone, and so the tendon can be tender, the bursa can be tender, and the result is the same. So what do we do about all these? Well, first off, if the problem's significant and stretching and taking your pain pills or ointments, whatever you've done is not working, you need to get in and see somebody that's professional, knows what they're doing. So coming in for therapy is a great idea. It's conservative treatment. We can do the evaluation, determine if it's coming from the back or the hip, determine if there's muscle weakness or imbalance, determine if there's a leg length difference, and determine what is. Is it a bursitis? Is it an impingement problem? Is it an IT band syndrome problem? Is it arthritis? So that's what we do. Then we can give the appropriate treatment, whether it be mobilizing joints, stretching joints, doing things such as ASTIM or soft tissue assisted tools where we break down the scar tissue or the tightened tissue or the inflamed tissue to try and improve it. Self stretches, we can teach you the correct exercises. And strength exercise to get the muscle strong around the pelvis and the hip so you can get back to activity. And cardiovascular exercise, always great, but you need to make sure it's the right activity. So for a hip joint arthritis, this could be the right activity. For an IT band syndrome or hip bursitis, this could be contraindicated. That's why you need to come in and let us help you and get you on the right track. So hope this has been some good information for you. If you've watched this and it doesn't have anything to do with you, but you have friends or family members that you know are having some problems like this and they've been dealing with it and not making progress, give us a call or have them call us and let's get them in here and get them some help, because these problems are all problems that we deal with and we can help you with and improve your life. So they can give us a call at 801-476-2000 for a free consult, or they can email us if they have a question to kind of see, is this something that you can help with? And we're more than willing to answer that question. Um, and again, if you like these presentations, if you think they're helpful, we only know that by the people viewing it. So if you like it and you think it could be helpful to somebody, share this information, share the Facebook page address. And we also are doing Instagram posts as well that have information that goes along with these seminars that we're doing. So you can follow us at the Instagram page. We can see patients via telehealth if they really are uncomfortable coming in. And people think, well, can you tell anything just looking, over a camera? And we can. We can watch you walk. We can have you do some tests. Ideally, coming in is the best. But if you don't feel comfortable, telehealth is an option. And if you're not sure about that, give us a call again at the 801-476-2000 and we can chat about it. So again, if you enjoy this presentation, let us know. We'll continue to present these live Facebook seminars until we can get past this COVID virus, and then we'll start presenting in-person seminars where you can be there, we can demonstrate, and we can keep continuing to educate you and hopefully provide some service for you. So thanks again. Have a great day. Be safe out there. And if you've got problems, please call us. We can help you, and there's no use suffering. And this is the time of year you want to be active again.